Hello, in one of my previous videos, I talked to you about fainting and what are the reasons you may experience a faint. So how do we investigate fainting? So the most important of all is the history, which I will get from the person who has fainted or from the eyewitness, which can help us to determine what may be the probable cause of the faint. So some things are very obvious from the history, the circumstances surrounding the faint. I also take the lying and sitting BP and the sitting and standing BP to see if there's a drop in blood pressure from lying to sitting or from sitting to standing. Now, a drop of blood pressure, that is the systolic blood pressure, that is the top reading of more than 20, is significant. And this may be caused by certain medications, for example, blood pressure reducing medications. It can also be caused by certain drugs patients may be taking. It can be caused by certain diseases, neurological diseases. It can also be caused by common diseases such as diabetes. The other tests that I ask for are an EEG, which will pick up seizure activity in the brain. Now, somebody who's experienced a seizure may not remember what has happened, but the eyewitness is very important in these circumstances and they can usually tell what has happened. For example, after falling to the ground, did the patient have jerks of the body? Did the patient lose continence and pass out urine? And was there any tongue biting? And how long the person took to recover after having a fainting or a seizure? So all this becomes very important in the history by the eyewitness. So an EEG can pick up discharges which will show evidence of seizure activity in the brain. But in 50 or 60% of people, sometimes no seizure activity is seen because sometimes in between attacks, the EEG may be normal. So a normal EEG does not totally exclude that you've had a seizure. I also ask for an MRI if warranted, and an MRI may pick up certain developmental abnormalities in the brain, which may predispose someone to have a seizure. An MRI may also pick up a brain tumor, which if strategically located can cause fainting. And depending on the history, I also request for an ECG and an echocardiogram. Now, some people faint because they have an irregular heartbeat. That is, the heartbeat is too slow, sometimes the heartbeat is too fast, or in the same person, they may have a slow and a fast heartbeat. Now, this can be picked up on a 24-hour ECG that's called a Holter. A Holter is a 24-hour ECG monitor which may pick up an irregular heartbeat which is too slow or too fast. And these people, it is determined that they have an irregular heartbeat, either too slow or too fast, may require a pacemaker. In young people sometimes, you may also have an abnormality of the ECG which may predispose you to faint. Now this is a condition called long QT syndrome, and it is an important cause of sudden death in young. So even young people can have heart rhythm abnormalities, and in this case it's called a long QT syndrome. It can be seen on a normal ECG, normal 12-lead ECG tracing. You do not need to do a Holter for that. The other causes of fainting which can arise from the heart are if you have a structural abnormality of the heart. For this, I request an echocardiogram which can pick up certain valve abnormalities, for example, aortic stenosis, where the aortic valve may be narrowed, and this causes fainting when you're trying to exert yourself for exercise. And if you're young, you may have a congenital condition called HOCM, hypertrophic obstructive cardiomyopathy, where the heart muscle is excessively enlarged or hypertrophic. So it is wrong to assume that if you're young, you do not have a heart condition which can cause you to faint. So of course, it's more common in the elderly to get heart conditions causing them to faint, either due to an irregular heartbeat or due to valve conditions or heart muscle conditions. But young people can also faint due to heart conditions, and the most important ones are long QT syndrome, which I've just described, and HOCM, hypertrophic obstructive cardiomyopathy. So these are important causes in young people which can cause fainting and sudden death. So sometimes the cause of a syncope is not obvious, and then I ask for a tilt table testing, which will show if you have any syncopal tendencies and if you have fainting that may be caused by drop in blood pressure or fainting that is caused by your heart rate racing very fast. And this can also occur in young people, where their heart rate races very fast and they have a drop in blood pressure and they may faint. So these are the common tests that I do when someone comes in with fainting. There is some blood tests, and then depending on the history, an EEG and an MRI, and an ECG and an echo, and sometimes you may require a tilt table testing to determine if you have any syncopal or fainting tendencies. I hope you've enjoyed this video. Thanks for watching, and I'll see you next time.